2.5 million Californians have no health insurance whatsoever.
They are not going to doctors, they are not getting preventive care.
Or a family member or their children become ill, they put it off.
I've actually taken care of people who died of cancer because it wasn't diagnosed.
Of something that would have been so simple to treat, so inexpensive to treat.
Uninsured Californians primarily access health care today through emergency rooms.
Visit the public hospitals that are in the Los Angeles area.
You look at the situation of MLK Hospital where a patient died on the, in the waiting room.
A lot of these uninsured people are very hardworking men and women.
Medical care costs in the last 10 years have increased by 98%.
So over time, members' wages, real wages, go down while premiums go up and up and up and up.
Healthcare has become the most critical part of our benefits package.
Teachers, we have healthcare. We're fortunate we have healthcare. And yet when we look and we see how much we're actually paying out of pocket.
Members who are unable to afford the copay at the time actually go without seeing the doctor.
Over the last 20 years, I have seen a steady erosion of our ability to continue to maintain the same level of health benefits at no or little cost to our members.
Our last negotiations, we kept everything the same, and we thought that was an achievement.
Healthcare is not secure for anybody, even for those of us in the labor movement who have fought for it and think we really have it.
Labor has always supported large initiatives that were much bigger than just how it affected our individual members.
So the plan that we really need is Senator Sheila Kuehl's SB 840. This is the California Universal Health Care Act, which provides health insurance for everybody.
And the state Senator Kuehl wanted to ensure that she had labor support.
The Labor Task Force for Universal Health Care was started in order to allow labor to play a leading role in the fight for changes in healthcare for our unions and for our members and for society as a whole.
One of the problems that we have as individual labor unions is we all have our own benefit plans. And what we need to do is see how universal health care will benefit all of us, by all of us coming together not only with labor unions but the people of California to come under one universal health care umbrella.
Do you want good health care? Do you want it to be affordable? You want it to be universal? Brothers and sisters, enough of workers having to sacrifice more and more and more. Blue Cross? Double Cross. Blue Shield? No Shield.
Because in this state right now, 6.5 million people don't have the health care that they work hard for and that they deserve.
In the California legislature, there are 43 members who are co-authors of this bill.
We are the only ones that can make it happen.
The main obstacles of fundamental healthcare reform are first and foremost the profit-driven nature of this business.
Last spring, Blue Cross of California took $1 billion, $1 billion that should have been used to provide vaccinations, medical care, mammograms.
These HMOs, these big pharma, these big insurance companies delay and deny care so they can just make more money.
The problem of having insurance companies in this business is that they then drive the business, and it's based on their needs and not individuals' needs and healthcare needs.
A lot of these companies that don't offer their workers insurance, they're out there bidding against our contractors and they don't have the cost of the insurance. That just inspires more and more companies not to offer insurance so they can compete in the open market.
We cannot continue to pay the bill to maintain these health plans, and as a result, it's precipitating strikes. Look at our 141-day strike in 2003, 2004.
This is an issue that affects all of us, whether we work in the public sector, in the private sector.
The basic idea of single-payer healthcare system is that everyone will be covered.
SB 840 covers vision, it covers dental, it covers hospitalization, it covers prescription drugs, it covers doctor's office visits, it covers everything. It covers the whole state of California. California becomes one big healthcare pool.
A single-payer healthcare system will put our needs, workers' needs, everyone's needs first, take the insurance companies and their profits out of the system.
40 years ago, America solved this problem when it created the Medicare system. They provided a universal single-payer system for everyone that was over 65 years of age. A system that has a 2 to 3% administrative cost versus the 17% that the health insurance companies have.
We would be taking all the insurance companies out of the for-profit insurance business.
So it doesn't matter whether you're a benefited or employee or non-benefited employee, everyone, as long as you're in California, will have health coverage.
All other industrialized nations of the world have some form of single-payer health care. There's no reason we shouldn't. There's no reason the people of California shouldn't lead this nation to health care for all.
Single payer is the only way to achieve health care for patients based on medical need, not based on their ability to pay.
It's just so egregious that people have to fight for their health care. It should be a right.
We could do it today. The labor unions can then bargain for take-home pay, for other benefits.
And we could negotiate on behalf of better working conditions that would bring more nurses to the bedside.
Many of our public sector employees are part-time workers who may not have health care provided to them through their jobs because of the number of hours they work. A single-payer system would provide health care for these employees as well as full-time workers, as well as those who are unemployed.
With universal health care, many of the patients who access their care primarily through an emergency room will in fact now have access through an urgent care center or through a routine regular doctor office visit that will be paid for by the state of California.
SB 840 would also make sure that everybody has access to the healthcare provider that they choose.
The savings alone would provide enough money for everybody to be part of that system.
We have to pass this bill, but it's not only about passing it.
In 2006, SB 840 was passed by the state legislature, but when it hit the governor's desk, he vetoed it. Let's send it back to him and make him sign it.
I want to invite all unions to join us in this labor task force for universal health care.
As progressives in the labor movement, it's very important for us to realize we're all in this together.
While we may have tactical disagreements now, or different strategies for how to get to our goal, in the long run, we all know that a single-payer system is the only one that's going to meet our needs, take care of us, our families, and take health care off the negotiating tables.
And it's in the best interests of labor and the business community to really have healthy workers able to produce the wealth, share in the wealth.
Look, this is a realistic thing. We can get this done. With the forces of organized labor and the people of California coming together, we can do this.
We will get guaranteed health care in our country if we all stick together and work together.
There needs to be a viable remedy, and the single-payer system is the viable remedy.
It's what we need.
It is in the interest of all labor to join in the fight for a single-payer system.